types of fibroids, depending upon their location in the uterus. There are 4 types of fibroids. Submucosal fibroids develop in the inner lining of the uterus and protrude into the uterine cavity. Intramural fibroids grow within the muscular wall of the uterus. Subserosal fibroids extend outside the uterus, growing on the outer uterine wall. Pedunculated fibroids attached to the uterine wall by a thin stalk. Symptoms: mostly they are asymptomatic, but in severe cases, following complaints occur in such patients: menstrual changes, heavy or prolonged menstrual periods, bleeding between periods, pain, pelvic pain, lower back pain, pain during intercourse. Pressure symptoms: frequent urination, difficulty emptying the bladder, constipation, bloating. Reproductive issues: infertility, recurrent pregnancy loss, complications during pregnancy and labor.